this is Dr. Adam Kopsky from Advanced Rehab Medical here in Jackson, Tennessee, and I'm coming on today to talk to you about our topic that we have going this week. As always, when you guys come in, be sure to grab these. They're over in the rehab department by the tray, and there's a whiteboard above it that talks about it. So I'm going to do a two-part series. Today I'm going to talk to you about what we have going on. It's called what is a lumbar disc lesion? And so a lot of you guys have heard the terms disc bulges, herniations, ruptured disc, and so that's when I want to talk about exactly what that is. So when we start out with the fibers and the disc here, so here's an individual segment. Now here's your disc here. Now the whole purpose of the disc is to provide cushion in between the bones, what we call the vertebra. If we didn't have that, then we have bone on bone, then we're getting some really bad problems with developing bone spurs and arthritis in there. So we need that cushion there to provide support. So this disc, a lot of you may not know, is actually made up of water. So our whole body is made predominantly of water, and so as we age and we add extra stress on top of this, we tend to wear that hydration out, and then that's when the disc can actually shrink. So maybe a lot of you have actually shrunk when you got older, and that is how that process happens. So what we want to do is protect that disc, and so over time, it's typically not a single traumatic event, although it could be, but over the years of abuse, we go through stressors with our work ergonomics. Maybe we're sitting so long, we're susceptible to vibration, a lot of bending and twisting. That can actually damage the disc, and so the outer portion of the disc is actually a ligament. And so when we first start to damage those, they start tearing. And the more and more that tears, that's when the progression on a continuum starts going from bulge, and then if more and more starts tearing, then it can herniate and actually rupture out. And then we're getting, it's not only low back pain, but more into leg pain radiating out. And so that's what the handout will go more in depth, just about going over what exactly a disc lesion is. But any kind of damage to that is a disc lesion. So I would like you guys to please tune in next week. I'm actually going to go over what the current best practice method what the current best practice methods are of actually treating the disc lesions. And so we look at the current evidence-based practices there to see what actually works, what doesn't work. So please tune in next week, and we'll address what we can do to fix this. I hope you guys have a great day.